Okay, before we start, I'd just like you to watch this quick 3-minute video showing what the Stryker Mako Robotic Arm system's all about, how it works, why it's so good, and visually what you're going to get done and how it outperforms any traditional double knee or knee replacement procedure technique. Sit back and enjoy.
You have the potential to more accurately place implant components compared to plan with the help of Mako Robotic Arm-Assisted Surgery. Introducing Mako Total Knee, a key milestone in orthopedic surgery. The Mako Total Knee application features our clinically proven triathlon total knee system. Mako Total Knee expands our current Mako offering to provide a comprehensive solution with proprietary robotic arm-assisted joint replacement technology. The combination of the Mako partial knee and total knee applications allows you to offer robotic arm-assisted procedure for your patients for both partial and total knee indications. Mako now addresses the knee continuum of care and enables you to select the appropriate robotic arm-assisted knee solution for each patient. The Mako Total Knee application was built upon the foundation of clinical success with Mako partial knee, which has been shown to be 2 to 3 times more accurate and 3 times more reproducible than manual techniques, which resulted in less pain in the 90-day post-operative period and 92% patient satisfaction at 2 years. Mako is designed to achieve functional implant positioning, which is patient-specific implant placement as a result of enhanced planning, dynamic joint balancing, and robotic arm-assisted bone preparation. These 3 core features were adapted to enable a Mako total knee procedure with triathlon. Enhanced planning. CT data is segmented to create a 3D model of the patient's bony anatomy. The Mako total knee application allows you to position the triathlon implant on your patient's virtual anatomy prior to the procedure. This patient-specific preoperative plan enables more accurate implant positioning to plan. During surgery, bone registration and verification are designed to align the 3D model with your patient's knee. Dynamic joint balancing. Mako provides you flexibility to modify the pre-op plan. After completing a kinematic assessment of the joint, you can perform intraoperative adjustments to optimize implant placement. Robotic arm-assisted bone prep. The Mako Total Knee application does not require alignment instruments or cutting guides. Similar to Mako Partial Knee, virtual boundaries assist the surgeon in executing bone resections to the final plan. These virtual boundaries have the potential to protect essential anatomical structures of the knee during bone preparation, including the PCL and the popliteal artery. Once bone preparation is complete, you'll place the components using triathlon instrumentation. In a cadaveric study, on average, Mako Total Knee final bone cuts and final component positions were 5 and 3 times more precise to plan compared to the manual TKA control, respectively. The changing healthcare environment is creating uncertainty for many. Mako Robotic Arm-Assisted Surgery enables you to have a more predictable surgical experience and offers you a leadership advantage in our evolving healthcare environment. Let's create the future together with Mako Total Knee.
Okay, welcome back to day 10, double figures. 10 days since the operation for double knee replacements using robotic surgery with the Mako Stryker system. Still wearing compression socks. A lot to talk about this morning. For those of you going in for this operation, our bodies are all the same. It's pretty much like clockwork. Beautiful day in Sydney today. Autumn. It's the I think the 24th of March 2025. So let's talk about this morning. As you'll see, guess what's happened? There's little wrinkles coming back in. There's flab, wobble, which means that they're starting to drain. So having the bed on this angle, and look how steep this angle is on the bed. If I can just get a shot of it like that. You get it up with this little controller as high as you can because you're draining all the fluids out of the affected area into the lymphatics, which is the clear 2 runs of virtually drainage in your body through your nodes and through your body to your bladder, and you pee it out. So yeah, they're starting to get soft. They're starting to get smaller. There's still much swelling on the side here, and they're still a little bit warm, but they're not hot or red. So it's a really great day, so it's a really great day 10. You really get a sense of they're starting to accept them, and they're starting to not get red. They're starting to, now the swelling's going down, and it feels quite normal. The next issue, strength. Well, for me, I didn't do any quad work before I went in, didn't do any calf work. I was riding electric skate because I was pretty fit. I was renovating and working, so I had good stamina, muscle tone, and I had a a lot of strength in the legs, but didn't have these unique zeroed in sort of focused muscles like the quads and the calves. So what's happened now, like any other thing, when you go play a sport, you work out, do something, 2 days later the muscles get sore. It's always the second day. And my first training session of physio was on the Thursday, and I did backup Friday, and then I did Saturday, and by Sunday yesterday my quads were really sore, and my calves, to a point where anywhere I push on here hurts. It's all sore, like bruised. And why is it bruised? It wasn't bruised before. It's not bruised, just the muscles have been pushed so much by doing this stuff. I've actually, you don't tear them, but you start working them and they get very sore. That will go in the next couple of days, and that'll be fine, but you've got to keep pushing through that. The left knee has a bit of a pain at the top here, where the sort of, not where the actual replacement knee prosthetic is, but more back here where the muscle attaches to the top of the existing bone of the knee. I sense, because I think it hasn't been stretched like this for 11 years, but that'll be fine. The movement's still pretty good. It's about 9800. I've only lost a couple of degrees, so I think we'll get those back. So yeah, day 10's a very exciting day. You get your swelling goes down, the redness goes down. You get an incredible amount of non-pain, but more of an ache pain from all the muscles aching, which keeps you awake, and that means you need some heavy sleeping sort of medicine or some sort of prescription. I'm getting minoxicam doubling up for the anti-inflammatory, which I used on my knees when I was prior to operation. That's 7.5 going up to 15 milligrams, and 15 milligrams a day, 1 milligram of 15 when I sleep. Also getting melatonin, which is help me sleep. That'll knock me out. I slept from 3:30 till 6:30 today, which was solidly slept with that, which is going to help me sleep. Most important thing is sleep. So we're heading down to the pool for the first ever here hydro session at 3 p.m, which is walking in the water, etc. So I'll do a bit of filming of that, come back, and then maybe a final summing up of the day. But day 10, it's only 10 days since the operation. I'm starting to sleep a bit more like that, with that knee like that, or I'll sleep like that, or I'll roll to the side a bit. You're not supposed to, you're supposed to keep them pretty flat, but you've got to start doing this in a single bed in a hospital. You can't just lay like that forever. It's just debilitating. The next thing too is that roll up a towel and put it under your ankles, your Achilles heel, just there, to lift them off, so you're getting a better inflection back on your knee. That helps to keep the gravity just pushing your knee down flat. And lastly, this exercise, watch this, flexing down. I'm flexing the knee down to the bed like that movement. Not only does it improve the quads here and improve that stretch of the muscle and the quad touching and wrapping onto the bone, but it increases the movement of the knee down. But what you do is you do both together, down, hold, 1, 2, 3, 4, 5, 6 seconds, and up. 1, 2, 3, 4, 5, 6 seconds, and up. So you do that as many times as you can. That's going to make a big difference. So let's sign off this day 10 with just some finish off music and the hydro downstairs. We'll come back for tomorrow, day 11.